Hello, everybody. Welcome back to the Incubator Podcast live at Hot Topics in Neonatology. We are joined by one of the giants of our field, I would say. What do you think, Daphna?
Totally agree.
Dr. Nathalie Maître from Atlanta, Georgia. You are the Director of Early Development and Cerebral Palsy Research at Children's Healthcare of Atlanta. Welcome to the podcast. Your first time, we were discussing earlier.
Yeah, my first time. I'm a little nervous.
No. There's nothing to be nervous about. And you have a session coming up later today at 3:30 called Early Detection of Cerebral Palsy. I think it's a topic that is becoming very, very trendy, I would say. Lots of people are trying to see what we can do to try to move the needle earlier and earlier, to have any inkling of suspicion, maybe higher or lower for babies with cerebral palsy. Some recently reviewed, and we haven't reviewed that paper on the podcast, but like using AI, using video, using all sorts of tools, that's really seems like it's a big focus. Can you tell us a little bit about what are the implications of that? Why are we not happy with the way it's been all these years?
Well, in neonatology, we're never happy unless it's earlier, right? It's always about earlier.
Sooner, everything sooner.
Right. But really, for neonatologists, this is a huge topic because if you think about it, everything we do in terms of providing care to lower and lower viability infants is about not just the difference that we make for those infants, but for all of neonatology. By pushing those boundaries, we learn more and we develop better interventions, better care for them. So it's a lot like that for CP. It used to be that 4 years old was the accepted age at which it still is that we confirm cerebral palsy. And then people started saying maybe 2, right?
18 months.
Well, and even 18 months, but 2 seemed to be that number that we got stuck at for a really long time. And if you think about the large networks, not just in the US, but all over Europe and Australia, there was this 2-year-old assessment in all our clinical trials that really made us as neonatologists think that 2 is that number. And often we were not the ones diagnosing cerebral palsy. And I think as neonatology is changing, it's really helped us question whether we couldn't do things earlier also for diagnostic, for a diagnosis such as cerebral palsy. It's really important, right? It's the most common physical disability that originates in childhood and affects the lifespan.
Wow. Yeah.
And it's important to parents, right? This is a question they have already in the NICU. We're not very good at answering it because we don't have all the answers yet. How do you think this early diagnosis impacts families?
So I don't have to tell you just about what I think as a practitioner who's been doing this for 20 years, right? We know there's been good evidence, a lot of research studying how parents react. First of all, they've said they want this as early as we can suspect.
Yeah.
They're accepting of something that's called high risk for cerebral palsy designation, which is something the Canadian network that we talked about earlier and the US practitioners have said, this is a good thing. Starting conversations early in all honesty, integrity, and with the purpose of shared decision-making between a family and the medical team is really, really important. So parents, we know, want this. There are systematic reviews that show it, international practice guidelines that show it. But then there's the other burden of evidence, which is what happens when we don't do it. And that's really hard. If you suspect and you don't tell a parent, they actually suspect. Parents know their children better than we do.
Love that.
And so they suspect, and when we don't confirm that suspicion, when we don't openly talk about it, they start to lose trust, not just in us, but in the entire medical system. And it's been shown to have consequences for mental health of the family and for the outcome of the child as well, who doesn't then get into targeted interventions for CP, not just generic early intervention, but targeted interventions for CP.
Yeah, that was my follow-up question. If we can diagnose it sooner, then we can start working collaboratively with those families sooner. And we know that changes outcomes. those.
Yes, we do. And I love the fact that you use the word collaboratively, because that's really the point of it. I mentioned shared decision making earlier. I mean, it is very serious news. It is challenging to give. You have to get trained to do so. But with the right tools to detect, the right tools to counsel, you can have that respectful conversation with the family. And what they've asked us to do in multiple studies is to make sure we're not just honest and direct, but that we give hope. And people often ask, how can you give hope? You've just said your baby has cerebral palsy. The your life, your hope, your the light of your life has this lifelong condition. And actually there is hope. And when I diagnose now, it's not even the same as 5 years ago. There's been so much in the field of interventions, both for children and for families, that sort of this wraparound approach to the child and the family that is targeted specifically to CP, not just to any developmental disorder. And that's really revolutionizing how we talk about it. And we're very careful to tell parents, what does CP mean to you? What does cerebral palsy mean to you? And we have to spend a lot of time just saying, okay, yeah, maybe that's what it meant 10 years ago, 5 years ago. But you know what? In 5 years, when your child is 5 years old, your child will have neural gate stimulators. We already have them for older children. Your child will have the best of care and a different trajectory because we started at a diagnosis of 3 months instead of 3 years.
Right.
And so we're taking advantage of neuroplasticity in very targeted ways. And there are groups around the world, from Australia to Ireland to Europe, like all different countries, and even in the US, that are sort of leading those trials of new and early interventions.
And so what does it look like practically at the bedside? What has changed in terms of your standard sort of medical school neuro exam to a more targeted approach that really aims to try to identify the potential flags that would hint at a future that might be associated with CP?
So it's funny that you bring up medical school. That was a while ago, and I can honestly say I don't remember learning how to do a baby neurological exam in medical school.
They don't teach it.
First of all, I am a faculty at our local medical school. They do not teach
They don't teach it.
Well, we're trying to change that. So we are totally trying to change that. And at least I'm working in Georgia and with the Cerebral Palsy Foundation, who funds HINE training. So the HINE is a standardized neurological exam, and I developed a workshop for it, and the Cerebral Palsy Foundation said, let's make it available to everyone at no charge. And so we started training on that, but not just neonatologists. We started training early intervention therapists, pediatricians, to try to create a community with the same language surrounding early detection. And so that common language is really important because, and in the NICU, like alphabet soup is a big deal. For sure. So the HINE became one of those acronyms. Fortunately, the HINE sounds like HINE.
It's cute.
And actually, I know some neurologists, one eminent neurologist at Nationwide Children's, who refer to it as the HINE exam.
Why not?
But no, we have these exams that we train people in, and the HNNE. We also have things like the general movements assessment that is now, becoming much more frequent in NICUs. Right. Do you have it in your NICU?
I don't think we use it as a standard.
Right.
Yeah, but no.
But almost every paper that we're reviewing is starting to use it. So, yeah.
Yeah, so it's very much becoming standard care for detection of abnormal movements. If you think about it, a cramp synchronized, which is an abnormal pattern in the NICU, near term age equivalent. A trained practitioner can look at this, at the video, and in 2 minutes tell you, is this cramp synchronized? That is highly specific for spastic forms of cerebral palsy. And you can start a conversation then.
Yeah.
This is why you need to come to follow up. We're going to be there to hold your hand. We're going to give you all sorts of education, and we're not going to leave you alone with this. We're going to be there for you. And so I think what's changed, you asked me about medical school. So first of all, those assessments weren't there when I was in medical school. And I think the awareness that neonatologists could do them, and part of the neonatal team, like the neonatal therapist and all of that, all of this incredible team that we work with could be a part of this. So the thing to remember is that early detection of CP is multidisciplinary detection of CP. And so that's the best part, right? We become neonatologists because, well, I think so. We like working in a team rather than as a single alone practitioner. And this is everything I ever dreamed of in terms of teamwork.
And for the people who are in training, I would say that to me, the best place to learn how to do a good neuro exam was in follow-up clinic. Like I spent so much time in the follow-up clinic learning to examine babies at every stage, the ones that were coming back at 3 months, 6 months, and just do a thorough neuro exam, DTRs, the whole 9 yards. And again, and that's just, like I said, the basic neuro exam. And so I think you've given us a lot of tools to look up and to think about in terms of having this approach geared towards helping parents do at the very least risk assessment prior to leaving the NICU, and so that the proper support systems could
and
be
at 3
encouraging
months.
their follow-up.
Oh,
right?
absolutely.
Yeah.
That 3 to 4 month visit, we've shown in every study and implementation science that 3 to 4 months corrected age or term a chronologic age for a term baby is that critical visit that we all need to have in our follow-up programs. And Ricky Goldstein and her group at the AAP are doing fabulous work on trying to promote these kinds of standards for NICU follow-up. But I agree with you. In NICU follow-up, fellows have the time to look at these exams and try them out and really learn how to do them.
A lot of people go and wrongfully say, well, I'm not interested in follow-up. I'm not exactly sure how to make the most, at least learn how to do a proper neuro exam.
Yeah.
They will teach you how to do and look at what a neurodevelopmental assessment looks like. But if you can leave follow-up knowing how to assess neurologically a baby, then you would have done well for yourself.
And it won't be as stressful as in the NICU, right? You might get some Cheerios all over you. You might get thrown up on. It's the glamour of NICU follow-up, right?
And we love to give people resources. And I think you're right. I think people, even neonatologists, don't always understand cerebral palsy and what it looks like long term. So the Cerebral Palsy Foundation, for which you are on the Scientific Advisory Council, has some great resources.
Oh yeah, they have CP Resource. CP Resource is this incredible site that they made that works with the International Classification of Function and Health. That's the World Health Organization's framework. They have fabulous resources. And a lot of what's important about the way they present it is that it's by individuals with CP and parents with CP for others.
I love that.
And we had spoken on the podcast before about this book, which, by the way, is on my bookshelf and waiting to be read, but I haven't had a chance yet to go through it.
I bought it for you.
Did you?
Tell me the book.
The Boy Who Could Run but Not Walk. Yeah, thank you. It's still, I have a list of books that I'm going through it. So I haven't got to this one yet by Karen Pate, but...
So that one's not bad, but can I tell you there's a series coming out from Gillette's on CP by Lily Collison, who is amazing. So I would put Lily Collison, and she's working with Gillette Children's, and it's books that are made for parents. But I will tell you, I've helped review them, and as a practitioner, I learned a lot. And so Lily Collison, who's the parent of a child with CP, but incredibly
we should reach out
smart.
to her, try to have her on the podcast.
Oh,
for sure.
you should. And she's done this whole series of books on different kinds of CP, from how it happens to how it's going to look, and what are some of the things parents need to know.
That's great.
And for every kind of CP, I highly recommend her. She's got the best Irish accent. She's got to come on your podcast. You'll love her.
Perfect. Okay. Nathalie, thank you so much for dropping by.
So fun.
Yeah, this was fun. All right. Thank you so much.
Thank you.